Good afternoon and welcome to your weekly medical town hall here at Dakota 2, the center of the aerospace testing universe. If you are tuning in for the very first time, I am Gwendolyn Foster, your medical group commander. With me today, I have Captain Lankert, our public health officer, Captain Gordon, our mental health officer, and Captain Vrooman, our pharmacist, and he will be talking about lab today. And of course, my right-hand woman, Chief Bradley. And so some of you have tuned in and looking at our Facebook page, saw the post right before we came on. This is the last official medical town hall, but fear not. Town halls will still continue. Starting July 10th, there will still be the weekly town hall with General Higer, and medical representation will be there. So that way you have one-stop shop for all your questions. So even though this format is going to change, we are still there for you. So with that, I'm going to go ahead and turn it over to Captain Lankert so she can give you the current situation. Captain Lankert.
Awesome. Thank you, ma'am. Hello, everybody. If I could get the slides put up, please. So this is going to be your update for this week. And unfortunately, there's not a lot of good news to unpack. For the United States, we went up by 204,000 cases. That's 50,000 more than between the last week when I briefed you. Bottom left-hand corner, you can see where all the cases are raising in the United States as compared just color-wise to the other graph in the bottom right corner and the other map. So you can see that red's really starting, or that orange is really starting to spread across the nation. Most people are probably pretty aware of all the news reports and news stories in regards to increasing cases. So there have been the fastest rate yet of cases and hospitalizations rising. California just hit their new record single-day high Wednesday with over 7,000. 26 other states are seeing rises. Arizona right now is having to go into their surge capacity plans. They're predicting that that's going to happen by July 4th as far as their hospitalized COVID patients go. Poor behaviors, just like how you've heard at all the other town halls, are really starting to fuel this outbreak. And this is going to sound like kind of a plead, but really, to keep yourself and your family safe, you have to practice that social distancing. You have to practice that mask wear. The governor of California came out saying the same exact thing. That's what's fueling this right now. And as I mentioned last week, too, it's the younger populations that are being infected more often. And even though the outcome for younger folks that have COVID is usually a lot less severe than it is for those high-risk populations, they are literally the ones, myself included, I'm in that age category, that are spreading this disease, that are making it so that those older and more at-risk populations are dying from this. So it's going to be really grim, but that's what's fueling it. So if you don't even if you're not concerned about yourself getting sick, please be concerned for your neighbor, be concerned for your family members, be concerned for basically the rest of the nation at this point, that even though you might not have a severe outcome, you can still be that vector that gets somebody else sick that may or may not actually survive the disease. So that's just, it's grim, but that's really what's going on here. New York, Connecticut, New Jersey are asking travelers from states where the things are rising to actually quarantine when they come into their states. They're going to actually enforce that and put fines on people is what they're talking about right now. The European Union right now is considering barring entry from anybody from the United States due to our case trends changing so much. And just like I said, social distancing and risk management, that personal risk management we've been just driving home every single week. Make those decisions for yourself to decide, is this a safe place that I want to be right now? Are there behaviors here that are not just giving me that warm fuzzy or something doesn't seem right? Don't go to those crowded areas. Avoid them as much as possible. And if you do have to go out, which is absolutely fine, make sure you're doing so safely. And that's really what we care about here, is making sure our Edwards Air Force Base and beyond communities are safe and they're taken care of. That being said, next slide, please. This is going to be your drilled down idea of what's going outside the gates, basically. So this is going to be the last month or so. That big spike you see on the end is not an artificial spike. So as of right now, that is a true increase in cases in our local area. That's not because of a backlog of testing. And that right there was actually one of the biggest spikes we've seen in our community. As you can see, in general, we're starting to trend more so up. We dipped down a little bit there in the middle, but we're either staying stable or we're starting to see those kind of more alarming increases, and especially that type of spike. You can see the difference in the bottom left-hand corner. Palmdale itself went up 151, Lancaster 139, Cal City and Roseman not as much because they have a smaller population, but LA went up by 12,000. And again, your updates over in the right-hand corner is going to be Kern County hit a record high of hospitalizations. U.S. hit their new single-day case high. So all these trends are going across the nation, basically, but we're not immune to it in our local area as well. Palmdale, Lancaster both hit their record highs for new cases. And LA is officially the highest case count of any other county in the United States, and is only behind the state of Florida by about 13,000 cases. So again, this is just to reiterate that those personal behaviors have to continue no matter what's happening outside the gates. As you can see at the very bottom bullet, the past 14 days have accounted for about 25% of LA County's total caseload that they've seen so far. So again, this isn't supposed to scare anybody, but it's supposed to just say, hey, look, this is still going on. This is still very much a thing, and it is very much a threat. Please be safe with your family. Practice those distancing, practice those hygiene, and just use that really great risk management tools that we think we've been able to equip you with over the past, I don't know how many weeks we've had this town hall, about 14 times or so. But again, if you have any questions, even if it's not at the dedicated medical town hall, please at General Heiger's town hall. There will be a representative from medical, and then obviously on our Facebook page is another good way to reach out. So that's pretty much all I have for this week's briefing, and I'll turn it over to Colonel Foster again.
Thank you, Captain Lankert. Next slide. So this is your slide for as far as our services. So as you know, we are in HPCon Bravo. So you heard Captain Lankert talk about all the things that are going outside our gate. And so you may be questioning, well, how can we be in HPCon Bravo if that is actually going on outside our gate? So General Heiger declared us to be in HPCon Bravo because we are following those rules. We are doing those behaviors. So as we are doing that, we're trying to get to that new abnormal. What does that look like? So as we're bringing the force back on to the base, as well as we are opening up our doors virtually and face-to-face with our services. So you may see some of our services that, if you look at the ones that are underlined, how we're providing more services. So with women's health, we're starting to offer more face-to-face exams for well woman exams for our active duty. Also with our TRICARE operations, they actually are now open by appointment for release of information and records copies. And then our dental clinic, they're actually starting July 7th. They'll be coordinating with the unit deployment managers to be able to offer those annual exams for our active duty. And then in our aerospace physiology, they're starting to do some case-by-case hypoxic training for our warfighters that need that. So for us to be able to do that, to be able to provide those services and open up our doors more, we really do need you to continue to do those COVID-19 measures to keep you safe, keep your family safe, what helps us stay safe. Our community partners outside the gate, as far as our healthcare partners, they are holding steady, but they can only hold steady with you doing those measures. So you can tell I'm a little passionate about this, is because we cannot do this alone. So if you want to see this slide and see our services continue to open up and start turning green as we're trying to find that new normal, we're going to need your help to be able to do that. So with that, I'm going to turn it over now to Captain Gordon, who's going to give us a little mood food.
And thank you, ma'am. And that is our clinic number for the mental health clinic here at Edwards, 277-5291. And next slide, please. So foot stomping and foot stomping and foot stomping, exactly what Colonel Foster just got through sharing about maintaining what we need to do in order to keep our families safe. And this slide is one that we have really been promoting because it is very important that each and every one of you take note of all of the concepts that are listed on this slide. Today's slide is actually a true and false test just for you. So don't worry about grabbing a pencil or paper. This is what I'm going to ask you. True or false? Take care of yourself. Absolutely true. You have to do that. What does that look like? Sleep well, eat well. Make sure that you're getting outside, wearing a mask, and maintaining those social distances that you need to maintain your safety for yourself and your family, but also stay socially connected. Pursue some goals, true or false. Absolutely. There's a lot of people that are are stepping out of the box right now during this time because scheduling permits, and they are taking on maybe some new school programs and learning new concepts and watching YouTube videos or cooking different things, trying different things to keep the family together during this difficult time, because you can't go out to a restaurant as much as you used to. You can't go to these theme parks, so you're being creative in ways to entertain yourself as well as your family. Also, true or false, create and maintain a routine. Absolutely. You don't want to fall into that mind trap where you feel like it's just doom and gloom and you start drinking and picking up bad habits. So I have been sticking to a routine as if I was getting up and going into the clinic every day. Even though that we're doing a lot through telework now, I still maintain that routine. I still exercise on a routine basis. I still maintain that clinical routine that we do in our clinic to make sure that I don't leave room for anything that could potentially decrease my mood or create some sort of issue in my life. And true or false, maintain positive social connections. True, absolutely true, capital T. I want you to continue to do that. Do not turn into a piece of petrified wood out there and just become stagnated and isolated. You want to make sure you keep those family connections open. Technology is at its finest today as we have ever seen it before. Use it. It is there to make sure that you stay connected with people that you love and care about, and I'm sure they would appreciate that too. Think positively. Even though we are in a world where things are pretty negative, you can change that input into output being positive. So make sure that you are maintaining positive input so that you can stay in that positive mind. It's not always going to be a bed of roses. And as I said before, Disneyland, they're closed and they're not going to open, I'm sorry, until probably later on in July. They postponed that. So you may feel a little down about that. But reframe it in a way they're doing it for safety measures. They're doing it to keep you safe, your family safe, and others safe. And that goes for everything that we've been sharing with you today. It's very important that you continue to adhere. We are all here collectively together. The staff here in PA, medical, and I can't think of anybody who has really stepped up to bat for us more than Colonel Foster and the PA team here to make sure that we're getting all of this information out that benefits you and it keeps us all safe. And accept the role, true or false, that what's going on right now, and enroll with the change. Yes, you definitely want to roll with the change and keep that positive mindset that no matter what comes your way, that you're going to make it, and that if you can't make it, that you will make those connections with people that will empower you and strengthen you so that you can make it. And utilize the resources. True, you want to utilize resources for sure, and there's plenty out there, and we are here definitely to help you with that. And let's go on to the next slide, which is going to talk about something that, I know this is a very busy slide, so forgive me for that, but there's a lot of valuable information about PTSD Awareness Month. And June is PTSD Awareness Month, and it was determined in 2014 to be and designated by the Senate in 2014 in honor of a North Dakota National Guard member that unfortunately took his own life because he was unable to cope with the symptoms and PTSD. And so make sure that you are aware that this month is PTSD Awareness Month, and the 27th is PTSD Awareness Day. That's this Saturday. So that is the gentleman's birthday. And so when they decided to make June and declare June as that, they decided to make a day in June specifically in memory of this service member. And so what is PTSD? Well, it could be anything that is triggered by traumatic or terrifying events. So far, I mean anything, you can have those symptoms that can lurk around, and PTSD can come in many different forms, shapes, and sizes, and can definitely be caused by you either witnessing the event or experiencing it yourself. And that can come in many different forms. And we have a podcast coming up this Friday that's going to go in more detail about PTSD, what the symptoms are, what the forms look like, and treatment options. And I also did an interview with Captain Hoffman, and that will air next week on Wednesday on the podcast. That will go into more details about the various kinds and that he has seen in his practice, and also some treatment options there. And going back to the slide, in case you know someone that is suffering from the symptoms of PTSD, which can be flashbacks, nightmares, sleeping issues, super strong anxiety that just they can't seem to calm down, hypervigilance. Make sure that you help them. They're going to need some help. Do not run away or turn your back from them. They may not know how to ask for help. And it's a sign of strength when they decide and you decide to help them get help. It's not a sign of weakness. Call 911 if safety concerns arise. And also you can go to the nearest emergency room. You can reach out to a close friend or a loved one. Contact a spiritual leader or someone in your faith-based group that can help you. Or you can contact the National Suicide Hotline at 1-800-273-TALK. That's 1-800-273-8255. And you'll be connected with a trained counselor. And then press 1, though, they're in the menu. That way they know you're a veteran and they'll connect you with the Veterans Crisis Line. Or you can make an appointment with your doctor or mental health professional. There was a quote that I found that was very impactful. A lot of people have a hard time understanding wounds that they cannot see, the emotional wounds that a lot of people carry on a daily basis. And that could be from anxiety, depression, substance abuse issues. It can be from PTSD, you name it. Whatever is in the DSM-5, that is our Bible for mental health diagnoses. People don't see those scars and those bruises that mental illness can actually do to you. But always remember that they could have a battle going on inside and not even wear a uniform. And so this quote really stuck with me because people are at war sometimes in their minds and they really need that help. So please step up if you see someone struggling and help them get through those difficult times. And the quote goes like this: "My past is an armor I cannot take off, no matter how many times you tell me that the war is over." And that stuck with me because of you just don't know what's going on with people. You don't know what's happened in their life. Be patient with them and get them that help that they need. Step up and be there for someone. And keep reminding yourself to do those tips on the first slide and be there for yourself, but most importantly for others as well. The payoffs and the dividends, you can't even count them. And I know you'll feel good about helping yourself and your family or someone that you know is struggling from PTSD. And if we can go to the next slide, this is what the logo looks like for the podcast. It's on all the platforms. And we have just got approval from Pandora, and that was the only one we were really looking for. So I've already connected and completed that process, and we're waiting for it to be uploaded with that. But this is just a podcast that's there for you. I don't get paid for this. It actually costs me money, but I really enjoy it and I love it. And if you have any show ideas or anything that you would like for me to research or talk about, this is for you. This is to help you get through this difficult time if you can't get out and see someone, if you don't have anybody to talk to. If you just want to listen to my voice, or as annoying as that may be sometimes, but moodfoodpodcast@gmail.com, and just email me and I'd be happy to research and talk about something. Or if you know someone that would like to contribute to the show, I'd be happy to have them on, and they can give their story about how they've made it through difficult times in the time that we're living today. And next slide, please. And so this last slide is a slide with just a list of resources. As I mentioned earlier, if you are having a difficult time getting through today's date and time and what's happening in the world, reach out. Or if you're suffering from, or you know someone who's suffering from any kind of mental illness or any kind of thing that could be directly affecting their life in a negative way, resources right here are here to help you, whether virtually or through that physical distancing mechanism. But please take advantage of that. Everyone is here for a reason, and we want to make sure that you take advantage of that. And that is it for the mental health briefing, and I appreciate your time today.
Thank you, Captain Gordon. Now on to Captain Vrooman.
Good afternoon. As Colonel Foster had mentioned earlier, I am a pharmacist, but I'm here representing Laboratory Today, as they also fall under my purview. So just to give an update on what's going on with the lab right now, as you may have noticed a few slides back, lab actually is green. We've been green the whole time for laboratory services, so nothing has been reduced or subtracted from it all from this. Lab continues to be on a walk-in basis, so you do not need to call and make an appointment. I do want to make sure that I clarify the difference, though, between appointments and lab orders. So certain things, if you're trying to get green on your IMR for HIV, something like that, you can literally just walk into the lab and get it done. But there are a lot of labs that actually do require an order from a provider, just like a prescription to get medication. So even if lab is walk-in, it doesn't mean that they can automatically do whatever you need if you show up at the front desk there. You still need an order from the provider for a lot of the services that we provide. And that goes for COVID as well. So that's the one that probably everyone wants to hear about. I'm going to do broad strokes here to not get too bogged down in the details, but we do offer testing for COVID-19 here at Edwards. There are a few different ways to do it, and that depends on several factors. The strategies and the plans that we're doing are kind of changing as supply chains evolve and as testing capabilities evolve as well. But the bottom line is, to get tested for COVID-19 here at our laboratory, you do require an order from your provider. So please don't just show up at the window thinking that we're just going to do walk-in testing for that. We do have limited supplies, and it is based on a number of criteria, whether we're going to send it out and hear back in a couple of days or try and get a result right now. And those are, again, like I said, evolving protocols. So if you have any more questions, any more detailed things you want to know, please don't hesitate to text them, and we'll get to those at the end. But just to put your mind at ease, we do have that capability. It's something we can provide if the provider team decides that it is pertinent. And then that closes what I had to say for lab, but I did want to close with a public service announcement type thing on the pharmacy side as well. Throughout this pandemic, we're going to continue to see it going forward. There have been a variety of flavor of the month pharmaceutical treatments that you'll see pop up in the news. They might be popular for a while, and then they kind of fall out of favor, and you get some new ones. Please don't get medical advice from the news. If you see things like this come up, don't try to go out and obtain medications and guess at the dose. A lot of these things that pop up, either they don't pan out and it turns out they're not actually that beneficial, or even if they are, they're in very specific patient populations. For instance, you may have seen dexamethasone in the news lately. That's a pretty cheap, common steroid. If you really wanted to, you could probably find some, even if you weren't necessarily supposed to have it, but please don't do that. That has shown benefits specifically in patients that are requiring respiratory support. So if you're just popping dexamethasone in your home, it's not going to help you. It's only going to help you if you're already in the hospital, pretty much unable to medicate yourself. So that's just one example that's recent, but please don't take medical advice from the news. When you see things like that, even if it sounds like a great miracle cure, make sure you're discussing that with your provider and only taking things that were prescribed to you. And that's all I had.
All right, thank you, Captain Ruhrman. Next slide. Alrighty, so a big thank you for tuning in. So again, you see that number flashing across your screen. So please be sending your questions. But as you know, to flatten that curve, that is us all in this together. So we need you to do those safety behaviors. So again, wearing your mask. Once you go out that door, you should have that mask with you. Unless you can guarantee you're not going to come across anybody within that 6-foot bubble, that is the only time you should be without your mask on. Otherwise, that mask could always be on. You want to make sure you're maintaining that physical distance. You want to cover your cough. You want to wash your hands. You want to stay home if you're sick. Again, all the services that we're providing, all the things that we're trying to open up here on base, we can only do that if we are maintaining those behaviors to keep you safe, keep our family safe, and keep the community safe. So with that, now I'm going to turn it over to my right-hand woman, Chief Bradley.
Good afternoon. Okay, so today, for those just tuning in, I'd like to remind you who we have on our panel. We have our Med Group Commander, Foster. We have our Public Health Officer, Captain Linker. We have Captain Vrooman, our Diagnostics and Therapeutics Flight Commander, which includes pharmacy, lab, and radiology. And we have Captain Gordon, our mental health provider and Mood Food podcast creator. So you can text your questions in to the number you see on your screen, and then you can also post them on Facebook. I'm monitoring that here as well on my phone, and we will get your questions answered. We've had 2 come through so far today. The first, Captain Linker, this one's for you, and I think is very dependent on location or facility. Are we allowed to gather in groups of 10 people on base again? Captain Linker?
Yes, ma'am. So the guidance basically hasn't necessarily changed for that. So still per CDC guidance, per California guidance, per even base commander guidance, those non-essential group gatherings should still be minimized. Because every time you add people together, there's always that possibility of someone being either asymptomatic, someone being sick but not yet symptomatic. There's COVID risks basically that are there that are exacerbated depending on how many people you get together. So ideally, if you're going to get together, you get together in the smallest group possible, and then definitely minimize or don't have any gatherings that are non-mission essential, essentially. So I know a lot of people are doing blue-silver team type stuff. So if you get together with like your blue team or your silver team, that's one thing depending on how many people that is, but obviously mixing with other populations and doing get-togethers or doing parties. Unfortunately, it's still going to be the same culture of those like backyard over the fence barbecue high type situations. So, or like front porch gathering type stuff where you see people through doors or across yards or whatnot. So again, the recommendations have not changed from the CDC, from the nation, from any of that, as far as please minimize those gatherings, especially mixing different populations that may or may not have usually come in contact with each other.
Thank you. I'm going to add one thing too. If you do have something coming up like a ceremony, our public health team is there to help advise on how to do that safely. Next question that we had come through. If we have spikes in the local area, are we safe to be in HPCon Bravo?
Captain Linkert.
That's a great question. So, yeah, so basically, all that's telling you is that outside of our gates, obviously, is not an HPCon Bravo if we're using that definition. So outside the gates is pretty much still a COVID transmission area, still high transmission. Inside the gates, however, I know that base leadership really wants to put that onus on the individual, and so far behaviors have been pretty compliant. So as long as that compliance stays up, it's going to be, and people actually follow everything that we're saying here as far as social distancing when you go off. You don't stop in any of those crowded areas like city centers. You follow all the wing commander guidance. As long as that's followed, there should be minimal risk for HPCon Bravo. However, I do know that the base commander is currently watching very closely to see how compliance goes. So if for some reason compliance does not match our HPCon Bravo level, and it starts to present a risk or there starts to be some very concerning trends, I know there's a possibility of potentially that changing. So again, a lot of that's going to be contingent upon people's behaviors. It's literally just behavior at this point. If everybody does what they're supposed to do, we should have a minimal risk, and we can continue opening up services. However, again, the moment that doesn't look like it's happening, that situation could change.
Right, and I just want to pile on with that because we are a reflection of our society. So as we're seeing those spikes go up, as we're seeing that map that Captain Linkert showed starting to turn orange, if you notice and you're looking in the news, things are still reopening. We are really, as a nation, trying to find that new abnormal. But for us to be able to do that appropriately and safely, we are still going to need to follow those measures. So we are trying to do that in the best way possible.
Thank you. With that said, talking about reopening, schools are starting back up. Will the med group be involved in keeping our children and families safe?
Yeah, that's a great question. So my office has already been in very, very, very close contact with all of FSS, all of other school-based programs on the installation. We continue to be connected with them as well as far as opening up the schools go. So right now we're already advising them on plans, on procedures. We're helping to guide them with what's going on in the local area as far as what are schools outside the base doing, what's the school district doing, and so those plans are currently being formulated. So we're linked up pretty much at the hip at this point as far as helping to really guide that conversation and make sure that the situation N-word stays as safe as absolutely possible. Absolutely possible.
Thank you, Captain. Mask wear is one of those big preventive measures. What is the proper way to wear a mask?
Yeah, I will take that because I have my mask with me. So, proper wear. Am I correct?
Yes,
ma'am. All right, what is improper? This is not proper mask wearing. This is not keeping others safe. You wear your mask because you care, and this is the proper way to wear your mask.
It might be uncomfortable to cover your nose, but that's half the way that you respire out of your body. So if you cover your mouth, cool, when we're talking, but you still have to breathe. And if it's not covered, then it kind of defeats the purpose a little bit.
All right. And just a reminder, go ahead and text those questions in. We don't have a lot coming in right now, but we still have plenty of time to get your questions answered. Again, we have our pharmacy and lab expert, we have mental health, we have our med group commander and our public health officer. And we have about 20 minutes to answer your questions. One thing coming up, the med group is going to be closed coming up for the 4th of July holiday weekend. That Friday is the holiday, and then Monday is a family day, and we will be having Ask a Doc open on that day. So basically, if you call our nurse, we'll call our appointment line, so 661-277-7118. They will get you in touch with an on-call provider should you need it on the family day that Monday. Okay, and dental, there was a question, or we talked about dental services opening back up earlier. One thing to note, right now they're going to be getting at the active duty exams, not the cleanings that are normally a part of that same appointment. The reason for that is so we have to get our airmen medically ready. So they're focusing on the exam piece that'll get them in the green. And then part of the cleaning process involves a tool called a Cavitron that actually aerosolizes a lot of respiratory droplets. So that is too high risk of a procedure right now to allow us to do that. And as soon as we are able to provide cleanings again, we will be sure to let you know via our Med Group Facebook page. Okay, here's a question. I need to get a shot. Can I walk in to take care of that requirement?
So as far as shots with immunizations, that is by appointment. So if you call the appointment line, they will get you to where you can get an appointment to be able to get that shot. So immunizations is open, but that is something that we are doing appointment based.
All right, thank you. And let me see if I had any other questions come in. Let's see.
And while you're waiting for a question, Chief, so when Chief was talking about our lab, and that's walk-in. So even with that being walk-in, you still have to go through that ECP, and they're going to ask you where you're going in the facility. Again, that is to make sure that we are keeping everyone safe. Because if there are a lot of folks in our facility, then that increases the risk. So you may have to wait a moment at the ECP until it is clear for you to walk in to be able to get whatever lab services that you need. So that's how we're trying to mitigate with that being a walk-in.
All right, so we have no other questions coming through at this time. With that said, unless we get one here in the next minute, I would just like to say thank you to Colonel Foster on behalf of her medical group staff and her valued patients. It's been very important for us to get our messaging out to the public to protect our community, and she has been a great force in that. So thank you, Colonel Foster. And we did get one more question. My son is 17 and needs a sports physical. Can he make an appointment for that now? So I'll go ahead and take that one. The first question is, what you can ask is, has he been seen for anything in the past year? If he has been seen physically in the clinic in the past year, normally you're able to drop that paperwork off at our ECP, so our entry control point, that little trailer we have outside in the Med Group parking lot. You can drop that paperwork off. They'll take it to the clinic that afternoon, and then that doctor will review and provide it back to you within just a day or two, as long as he's been seen. If he hasn't been seen, right now the schools, we have an agreement with Muroc School District that they will waive that portion, the medical portion, of any kind of sports requirement until we're able to get those appointments in. But recently the clinic has started adding some of those appointments back. Best thing to do is go ahead and call or send a secure message to your provider or your child's provider so that you can get that need addressed. And TRICARE Online is the best way to contact a provider without having to go through the appointment line. You can get a account and send a secure message directly to the provider. You get a message right away acknowledging that they received your question, and then somebody's in communication with you shortly. And that said, that is our last question, unless anybody wanted to add on.
I'll say something.
Yes, sir.
So I just wanted to reiterate that I on this space and seeing people out and about, that is really encouraging. Keep doing that. Keep getting out there, wearing your mask and everything, trying to live some sort of normalcy that looks like you can live and be. And I'm super proud of everyone that has really stepped up and has really taken on all of these uncomfortable new tasks and new information that's being thrown at you every single day. And I would just want you to happy and with yourself and be proud of yourself for enduring everything that's been thrown at you. And I know sometimes it's very frustrating. I know you may feel like you're being controlled, and I know you may feel like you're out of control of things. But honestly, keep trusting in those reliable sources, and that's the information that's being shared with you here. That's the information being shared with the CDC and community agencies. And if you feel yourself starting to get really overwhelmed with information overload, take a break. It's okay to take a break from it and focus on something else. I just wanted just to say that being here on base and living on base, I really am proud of everyone that has really taken this seriously, and definitely be proud of yourselves as well. And keep fighting this good fight. We're all in this together, and you're never alone. And if you feel like you are, please reach out to someone. We have the world's best Air Force right here at Edwards, and that means first sergeants, commanders, and airmen and civilians. And we're all here stepping up during this difficult time to offer services that otherwise you may feel like aren't available, or you may feel like it's not the right time to take advantage of that. But don't give up. Keep pushing forward. We're all in this. We all feel that frustration and pain and rules and restriction. Believe you me, every time that we go shopping off base, I have to make sure I have my mask. I have to make sure I have my ID. I have like a whole checklist of things that I've added to my normal routine, but it's to keep myself safe, but most importantly, keep our friends and neighbors safe as well. So I just wanted to say something positive, that just keep doing what you're doing. Hang in there. We're all in this together. And if you need an extra level of care, let us know. We're here for you.
Thank you, sir. We did get 2 more questions in. With the base moving to Health Protection Condition Bravo, will the Child Development Center and School Age Program be able to accommodate more children in each room? Unfortunately, we can't answer that. That question would be best directed to your team at Force Support Squadron, and perhaps also tomorrow at General Higer's Town Hall, that could be addressed. And then the other question is, good afternoon. If we active duty have medical appointments outside of dental, meaning blood work, MHA, mental health assessment, that are coming due on our IMR, individual medical readiness, do we need to reach out and schedule them, or will this be automated due to COVID measures?
I'll take that one. That is a very good question. So right now, as we are scrubbing all the lists, they are actually reaching out to the unit deployment monitors. But that is something we'll make sure, because we do not want that to slip through the cracks and be a gap. So if you you know that is coming up, you can be proactive and call our appointment line number, and that way make sure you get the appointment you need, but we're also make sure that you're reaching out appropriately as well. That's a good question.
And we do have waivers in place for many of those, but that doesn't mean we're not getting at them. So for significant needs, normally if you're within 60 days of deployment, we will get you right in, call the appointment line and let us know. And then as well as other needs on a case-by-case basis, we've been working with units and commanders. That is our final question. Colonel Foster, over to you, ma'am.
Alrighty, so first I just want to give a big thank you to Public Affairs for making this possible for the many weeks that we have been providing this medical town hall. And I also want a big thank you to everyone out there that have been tuning in. It really means a lot to the medical group. As you heard Captain Gordon say, we are all in this together. So that has to continue, regardless if it's in this format or in with the weekly town hall, which we'll be doing with General Higer. It doesn't matter how it's being done. It's the fact that we are doing it and we're doing it together to beat COVID. And to the men and women of the 412 Medical Group, this wouldn't be possible without you. You are the subject matter experts. Continue to lead from the front. Continue to be that example. So that way that we can provide what is needed to our community, because as you know, we are here to support the warfighter and strengthen the community. And with that, this is my last medical town hall. You will continue to be in capable hands. Our new commander coming in on Monday is Colonel Daniel Lamont. And so he is excited to be coming in and to be your commander, just as I was excited to come in. And it has been an incredible journey to be going through this with you. And I am humbled to be your commander. Thank you.